That's fine. No problem. Okay. Thank you for being here this morning. And today's presentation is from our community healers here at Christ United Methodist Church. One of the things that I would like to say is that the church has not often recognized and supported the ministry of laity. The day-by-day tasks confronted in the workplace. It is empowering when a person understands this daily work as ministry. The job may not change, but how one does the job can change. The church community needs to support and help persons learn and grow in their awareness of God's presence with them in their workplace and daily life. So I'd just like to open with a prayer for our team. God, we thank you for those who have stepped forward to serve those who are in service to us in this community and to bring healing in this time of the pandemic. Amen.
And now we have a working handheld microphone.
Welcome. We started the Community Healers team in January 2021, 10 months deep into the state of a peacetime emergency in Minnesota due to COVID-19. We worried about the well-being of our community members and our healthcare workers. Emergencies are not supposed to last that long. Even the most resilient among us, we feared, would find their limits of endurance. In response, we assembled this group via Zoom in order to brainstorm strategies that might help. And before I go on, I'd like to introduce you to members of the team. We'll start with Nora Lynn. If you would just say your name and why you're on the team.
My name is Norlin Carpenter. I moved here with my daughter, who's a doctor at Mayo Clinic. And that's the reason I want to support this group, because I know what they go through.
My name is Bobby Nichols. I've been interested in this group because my background is in mental health, and I know how trying these sorts of prolonged emergencies can be for everyone. I also have a daughter who's a physician assistant at Denver Health and know firsthand what kind of stress our healers are under.
So it sounds like we need to.
Thank you. I'm Pat Robbie, and I've been in nursing for many, many years, so I appreciate the work of the caregivers. Our daughter is a physician, and I'm well aware of the stresses that they undergo every day. This has been a challenge.
I'm Lisa Kirkland. I'm an intensive care doctor at Abbott Northwestern Hospital in Minneapolis. I work a little bit at Mayo Clinic as well.
I'm Warren Thompson. I'm a physician at Mayo Clinic. I don't have as stressful a job as my wife, but I joined the group to support her.
Hi there, Tom Yeager. I do primary care internal medicine.
Hi, I'm Karen Heaston. I'm the program director of the clinical pastoral education. I train chaplains, and I get to hang out with the people who are on the front line as chaplains all the time. And I know the incredible stress. I also read the statistics every day and cannot imagine dealing with so many people who are sick.
Hello, sorry. My name is Urbana Vanderheiden, and I'm a nurse on Gonda 10 outpatient chemotherapy at the Mayo Clinic. I've been in the nursing field for 14 years, and I'm on this team because Daphne's so awesome and she's taking good care of us.
I love this 8-sided model of health and well-being, which is hard to read because it's just got overexposed when you put it in slide form. But the ones that yellow is social and the green one is financial. You may have seen this model on display in the window next to the kitchen. And think of the 8 sides as doors into the well-being of the whole person that the octagon represents. When there's a loss through one door, such as the loss of a job, an illness, the loss of a relationship, a person's well-being can be repleted through the other doors, such as via prayer, the support of friends, physical activity, and so on. We search for ways that we could buoy well-being through multiple doors. For example, we hosted 2 intergenerational outside play dates this summer. In plain terms, that meant lawn games at Soldiers Field and a visit to Zolman Zoo at Oxbow Park. Both offered mental, environmental, physical, and social routes to enhance the well-being of participants. Knowing that our healthcare workers were physically and psychologically exhausted from long hours, we sought an intervention that could travel by mail and be enjoyed repeatedly. We sent quarterly letters that contained a poem, a prayer, a statement of gratitude, and a token that would serve as a tactile reminder of God's love and ours. Last month, we included paper airplanes, like this one. Bob, would you please read the poem that's on the right wing?
You were born with potential. You were born with goodness and trust. You were born with ideals and dreams. You were born with greatness. You were born with wings. You were not meant for crawling, so don't. You have wings. Learn to use them and fly. Rumi.
Thank you. Now let's hear some stories about what it's like to be a Christian healthcare worker during this COVID-19 pandemic, which is now 19 months old in Minnesota. 3 members of the Community Healers team will discuss the interplay between their faith and their professions. We'll start with Tom Yeager.
I've never used one of these. I guess it's working. This is my first time back, first Sunday back in the pandemic. So it's great to be here. In thinking about what to say, you know, the story of myself and my family going through illness is really what immediately came to mind. I came here as a newly graduated physician in 1985, and all the technical expertise that I got from my education was necessary but not sufficient for the work of healing. And best thing that happened to me is I met my wife, Terry, and we were married in this church in 1987. And been part of the congregation ever since. And it's been an enormous, enormous support. Many of you know me. A couple of you were probably at our wedding. Well, you know, I was eager to be started as a physician and doing good work. And, you know, the first thing that really was a major challenge for us is when one of our family members developed a chemical dependency. And we had a young family, and it was very obvious, you know, we could not control what was happening. And we really had to rely on things unseen, because there are things that happen to us that you can't just go to the emergency room for. You can't just, you know, go into a locked unit. You have to live with it. Chemical dependency, the recovery community is the the example I would hold up for faith in action, for a belief in that you cannot see, and real person. And so I did not see this as a rule book. I saw it as stories of faith. And it was really tremendous. It really got me through, this crisis in our family, and was able to support Terry as well. Until the next crisis. When Terry faced a life-limiting illness. And I learned that grief and renewal go hand in hand. They're two sides of the same coin. The Sunday after Terry told me she was stopping her chemotherapy, we were in this room. Pastor Martha just came over to us. How are you? And it was the best greeting I ever received, to know that we were welcomed and known and supported. And she is right here. She is right here. That was 4.5 years ago, and she is right here. And the healing has been tremendous. So now we're in the era of a pandemic, and I think we all know that if you're empty, you can no longer heal. And so we need to find every source of renewal we can. It is not easy, and it is a marathon, and we think we're indispensable. We're really trying to kind of believe that we can make the difference for everything, and we can't, nor should we try. And so I've clearly reached my limit a couple times, but it's an honor to serve the community, and also our learners, our patients. And I thank you very much for the presence of the congregation all these many years. Thank you.
Hello? Not yet? Is it working? Can people hear me? Okay. So like I said earlier, my name is Urbana Vanderheiden, and I work in outpatient oncology at the Mayo Clinic. 9 years before I took that position 2 years ago, I worked in pediatrics over at St. Mary's. When I was preparing to share how my job, I'm so sorry, I got a little tickle. How my faith and my career coincide, I rewatched the documentary done by Ken Burns on the Mayo Clinic, Faith, Hope, Science. And I love that they put the words in that order, because if it wasn't for the sister Alfred Mose having her vision that the Mayo Clinic would someday be a healthcare mecca for everybody in the world, she would not have worked so hard to raise the money to build St. Mary's Hospital. And she wouldn't have convinced Dr. William Mayo, who is an agnostic to run her hospital. So it's just really cool to be a part of an organization that recognizes the faith and the spiritual part of it. And science does come into it, and the fact that they're always trying to find the next best thing to help a person, and like the needs of the patient come first. So they always center their care on the patient. And I just love that, because when you think of all the stories of Jesus healing, it was always these people who were so desperate that if they could just touch the hem of his garment, they knew they would be healed. Or if they just went to him and he came and he was there, they knew that their faith would save their loved one. And being a part of the Mayo Clinic every day, especially working in oncology, I am on like the edge of medicine. You know, you're seeing changes every day, but the biggest thing I get to witness every day are the miracles that are happening, and the people who were told by doctors and other things that they had nothing left. They are coming to us for that touching of the hem of the garment, to be like, if I get to the Mayo Clinic, I know that I have a chance. And it's just such an honor and a blessing to be a part of that, to be witness to that, to see miracles happen. And it's just really cool. And I thought it was really cool because William Worrell Mayo was an agnostic, but this was his quote about his religion. My own religion has been to do the good I could to my fellow man, and as little harm as possible. If that doesn't sound like a John Wesleyan theology, I don't know what does. So when I work daily at Mayo, I see the faith in action. And one of the really cool stories in the documentary that I wanted to share with you guys was back when the Mayo Clinic opened, a family in northern Minnesota put their 6-year-old daughter on a stretcher, put her through a window of the train, and brought her to the Mayo Clinic. She had been having fevers on and off for 2 weeks and was progressively getting worse. And they knew that if they got her here to the Mayo Clinic, they'd have hope. They took her immediately into emergency surgery. Dr. Mayo provided it. She had appendicitis. And they said if it had been 1 more hour, she would have died. And infection set in, and they had to do another surgery. And infection set in again, and they had to do another surgery. But the nuns sat daily by this little 6-year-old's bedside and prayed for her and played with her. And they prayed for her in all their services. And that little 6-year-old girl back in the 1800s, late 1800s, lived to be 96 years old. And they said that if we only look at the material side of the world, you know, and only focus on the science part of it and don't introduce that spiritual, then we're going to amount to nothing. So Dr. William Mayo recognized that spiritual was just as much as important, and having that faith and that trust and that hope in the healing process as, you know, just like having the science to figure things out. So if you see me praying at the boxes on Sunday, I'm usually lighting a candle for a patient, you know, for a fellow coworker who's had a rough week or whatever, because I know that that spiritual component of it is very important. I'll pray on my chemotherapy bags. I know it's not always good stuff we're putting in patients, but I hope that it will heal them, and or at least give them time. You know, that's a big part of what I do too, is we give them a lot of extra time. So thank you for praying for us. Thank you for helping us. During COVID-19, we were the only unit that stayed open at the Gonda building. It was like walking into the Walking Dead set every day. Downtown Rochester was nothing. It was so barren and so lonely. And we were there. giving chemotherapy. We never figured out how to give that online. So, yep. So, so yes, thank you for having this ministry for us and for taking care of us as we take care of others.
One of these either, is it working? Yeah, it's working. Okay. They fall off my ears. I wasn't going to mention this, but I actually am another one of those little girls who brought here for Mayo for a miracle. I was 4 and I was born with a heart defect, and my parents, nobody else was doing surgery on pediatrics at that time except the Mayo Clinic. So my parents brought me here from Virginia, and I had my surgery here. And I can still remember some things about being here, the oxygen tent, and some things about St. Mary's, and being mad that they were going to give me some more shots and fighting and all that stuff. So I also don't really know exactly what I'm going to say, so I'm not sure what's going to come out. There have been so many times when I've finished a day's work and driven home or gone back to my call room, so full of emotions, not always happy ones, in fact, mostly not happy ones, that I wanted to share, and also things that I had thought about that I wanted to share and didn't really have any place to share them except unload them on my poor husband when I get home after a week. And now, you know, that I'm invited to do this, I can't think of anything. But I am angry, okay? I am really angry that we are in this position 19 months down the road, because I was convinced when the vaccine came out that we would be done with this within the next few months. And seeing what I'm seeing now every day is infuriating. It's hard to be angry with someone who didn't get the vaccine because they didn't believe in it or they didn't have time when they're dying in front of me, okay? But I am angry that that person is taking a bed that didn't have to be taken by them, could have been taken by somebody who needed their emergency surgery or something else. They are dying of a totally preventable disease. And having our ICU full of not just COVID patients, we do have other patients too, and taking phone calls from emergency rooms and doctors all around the country saying, you're the 20th person I've called. I'm trying to get my patient into your ICU. They are on 100% oxygen, on a ventilator. I can't do anything more at my hospital. I don't know what else to do. And I have to say, I'm sorry, I don't have room. We're trained not to say no, okay? We're trained to give everything we have to someone who needs it. And to have to say no is devastating to me and to any other clinician. And that makes me really angry. So I thought I have some slides that I thought I'd turn to when I ran out of things to say. This is just from October 7th, okay? Just COVID-19 ICU needs hit 2021 high, okay? Hospital staffs are exhausted. I feel for my nursing colleagues and my physician colleagues, my respiratory therapy colleagues. They are exhausted. I can see it in their eyes. I can see it when they talk. They're, you know, I'm trying to give my energy both to them and to my patients, and they're just worn out, and they are leaving the field in droves. I'm amazed every day when I come into work that there are any nurses left because of what they have to do and what they're seeing and the abuse they take from families and patients. It's just It's just mind-boggling. Okay. Next slide. So these are the COVID-19. This is actually from September. You see some of these diagrams online. Various hospitals put these up. This is at Allina, the system that I work in. And so this was total number of patients with COVID-19 at all Allina hospitals, not just mine. But this breaks down who was vaccinated and who's not and where they're at. So the patients in orange are unvaccinated. The white patients are vaccinated, okay? There are breakthrough infections. No vaccine is perfect. And you can be young and healthy and get a vaccine and still get a breakthrough infection and wind up in the hospital and even get really, really sick. It happens, but that is not a reason not to be vaccinated, because the vaccine really works to keep you out of the ICU, because there are 32 patients in the ICU and 1, 2, 3, 4, 5 of them are vaccinated, okay? The rest are not vaccinated. And those who are on ventilators in the ICU, you know, the breathing machines, 2 out of 21 were on ventilators that were, and those 2 were unvaccinated. I've seen some exceptions to that because I've had some vaccinated patients who are on ventilators. You know why? Because they're transplant patients, okay? They have no immune system. They get the shots. They do all the things they're supposed to. They go out grocery shopping. They run into somebody, even just standing in line, who doesn't have a mask on, who doesn't stay 6 feet away from them, and they come down with COVID. And they wind up in my ICU for months. Tracheotomy, feeding tubes, lines everywhere. I mean, there's a gentleman I'm thinking of right now. It's been 3 months, okay? He was a renal transplant patient. He did all the things he was supposed to do. I'm angry. Next slide. You know, I know these stereotypes show up in cartoons, but you know, you're not sticking that needle in my body. Okay, then the next slide is we're putting a breathing tube down. Okay, now you don't want to get a jab with a needle, but you know, you're going to get a breathing tube. Next slide. Now this is, I tried to find an analogous, there is one, but so this is the slide that some of you may have seen. You know, there's someone drowning, somebody coming by with a sailboat. Do you need some help? No, no, God will save me. Okay, somebody coming by with a rescue boat. Do you need some help? No, no, God will save me. Okay, and the guy dies, goes to heaven, says, why didn't you save me? And God says, well, I sent you 2 boats, you know. I saw one, I couldn't find it again yesterday, but there's one exactly like this. Someone saying, why didn't you save me? And God says, I sent you a vaccine. It's, you know, I don't understand it. And I don't even want to try to understand it anymore, why people are unwilling to do what needs to be done. Next slide. Okay, it's not one of my patients, but it could be. Okay, and I want to go and show this to town hall meetings and say, if you don't think you can wind up like this, you can. I know I'm preaching to the choir here, but I mean, I don't want to wind up like this. Who would? So that's a patient that is hooked up to there's a monitor screen up on the top. Down below that on this side, that's a ventilator, okay, with tubes going into the patient through their mouth, blowing air in and out of their lungs. But that ventilator can't do the job because the lungs are so stiff that they can't be opened up enough for gas exchange. So this patient is also hooked up to what we call ECMO, which is extracorporeal, blanking on it, what's ECMO? Extracorporeal something, membrane oxygenation. It's similar to what they use in heart-lung bypass for heart surgery, except we do this at the bedside in the ICU. And so blood comes out of the patient and it goes through there, it gets cleared of carbon dioxide and oxygen added to it, and it goes back into the patient. Okay, bypasses the lungs. I have taken care of many patients like this. We've often we have taken the maximum number of patients that we can take. We've had up to 7 ECMO patients in our ICU. In the past, they used to take, heavy resource anyway, very resource intensive. It used to take up a perfusionist, somebody to run the ECMO machine, as well as an ICU nurse to take care of the patient. Now we've trained ICU nurses to do both. So now there's one ICU nurse taking care of the patient, which includes all those drips, the ventilator, all the work that a patient needs. And then another nurse who's acting as the ECMO specialist, who's bouncing between several different patients in there. We've had so many nurses leave. We used to be able to have 7, and now we have a maximum of 4 because the nurses have left. They can't do it. Or we just have so many patients, we can't staff the ECMO beds because we have so many other patients. So there just aren't beds for ECMO. And patients wind up on this for months as well. We've had people on ECMO for, the longest we've had was 82 days. And Warren's heard this story. This lady, I was there when she came in, and I went with her down to the cath lab to get the tubes put in, to get her put on ECMO, and watched her almost die as we did it. We saved her life. We got her onto ECMO, into the ICU. She spent 82 days in our ICU, and I was there when her family took her off the ECMO, okay, and made her comfort care. That hurt because we put so much, we pour our energy into these patients to try to help them get better. And, it didn't work. And we tried for a long time and it just didn't work. It's heartbreaking. And I finish my shifts and it's like, what do I do now with all this emotion that I have? So next slide. So this is also all the things that can be at an ICU patient's bedside, not just COVID, other ICU patients. And I do want to point this out, that it says, next time someone says you're just a nurse, remember that there isn't a doctor alive that can set this blank up. And they're exactly right. I go in there and I'm like, something's beeping. I don't know what it is. Yeah, there's a button here. Should I push it? I'm afraid to push it because I'm afraid I'll do something. But I'm trying to learn how to do this because if there's something beeping in a COVID patient's room, the nurse has to come out of the room of the patient she or he is taking care of, gown up, go in, find the thing, and then come back out. So I'm trying to learn which buttons to push so I can help them with that. Next slide. So just informational, new COVID-19 cases per capita by age. So youngest is at the top and then oldest is at the bottom. I think that's 70 plus, I think it is. Down at the bottom. This is just from NPR's story on October 7th. And I wanted to, if I knew enough about PowerPoint, I would take the COVID vaccinations to date by age, which, again, youngest is at the top, oldest, I think that's 65, is at the bottom. And I would overlay those two. And you would see how the vaccines are working. Okay, because at the bottom, 94% of people in Minnesota have been completely vaccinated, 91% completely vaccinated, 38.9% are having the new cases. It's inverse. The number of new cases is inversely related to the number of vaccinations. I don't know. I don't know what else to say, except that I wish this had been done with a year ago. I think we could have had it finished a year ago. And do I think COVID is ever going to go away? No, I'm hoping that we can make it like influenza, where it's something that we get, a shot every year. I've never seen anything like this, though. I've been doing critical care since 1989. I finished my training. And I've never seen anything like this. I've never seen anything, I've never been in a pandemic like this, and I've never seen anything that does what this virus does to people. Finishing on a note of hope or spirituality. There are patients that we pour our energies into, we're proning them, turning them on their stomachs. The ventilator has reached its maximum. I can't do anything more with the ventilator to get the carbon dioxide out. Normal carbon dioxide in your bloodstream the level is 40. I have people with carbon dioxide levels of 100. I can't get any more oxygen into them. Their oxygen levels are, normal is over 90% and theirs is 80% or less. I've got nothing else I can do, but they hang in there day after day. And because they hang in there, the patient hangs in there, we keep trying, keep supporting them. And there are some that I can't explain why, but all of a sudden they just start getting better. And it happens pretty rapidly, usually. Just one day, instead of blowing 50 cc's of air into their lungs with the ventilator, they can get 100 cc's. And then the next day they're getting 200 cc's. And then the next day 400. And I can't explain it. It does feel miraculous when that happens. But I can't tell you who that's going to happen for. So we just keep trying until we just can't do anymore. And then sometimes we just have to stop. But if there's ever a hand that reaches down and picks some of those patients up, that's what I see. That's when I see it, because I've got nothing more. Medicine has nothing more, and then they just get better. So I don't know, that's kind of rambling, but that's what I have to say. I really appreciate this ministry and the opportunity to come talk to you all. So thank you.
Life in the front lines. So you've heard from 2 physicians and 1 nurse. And for the purposes of this ministry, we've expanded the definition of healthcare worker to include everybody who works at a healthcare organization, such as a hospital, a clinic, a first responder organization, a home care agency, a congregational living facility. And we're including everybody who works there, everybody from the parking lot attendant and the food service employees to the receptionists and the IT staff. All have worked tirelessly to soothe anxieties and creatively maintain services in the presence of increased demand and decreased resources. I invite you to again applaud the healthcare workers in our lives, in our congregation, and in our community. Many of the healthcare workers in our congregation remain unidentified. In pre-pandemic times, it just didn't seem relevant to include one's occupation when joining a church. We estimate that our list of about 115 healthcare workers represents only about 20 or 30% of those who could benefit from a letter of support. If you know someone who works for a healthcare organization in any capacity, please let us know their name. They don't even have to be a member of this church. We need your help to expand our reach and care for those who care for us. Let's move into the question and answer portion. And would the team please advance their chairs forward and turn to face the audience? And then cue me if you have a response, and I'll pass you the microphone, or you can share the mobile microphones. Are there any questions?
Thank you so much for this program. It is just popping my eyes back open again. Back in the big Rochester flood of 77 or 78, I'm hearing the deep water, people being boated from their houses. All this is going on in Rochester. I'm across town and I see a little water trickling down my street. So I had a hard time really believing that we were having a flood. To me, the same is true here. I'm healthy, my neighbor's healthy. I hear stories kind of. I try not to listen to the news. because that's so depressing. It's almost traumatizing to listen to the news. But these stories, I so appreciate them. They need to be out. I would love to hear one a week spoken at the sermon. Give them 5 minutes. People, I think, truly need to hear these. I have 2 friends now that I can't get together with because they choose not to be vaccinated. I understand being angry. Thank you so much for this program.
Thank you, Terry.
I do nothing related to healthcare. I work in manufacturing, but I do have a leadership position in a large organization, and I am baffled by people who will not get a vaccine. And when I was eligible, I was in like 4 days later, got the shot, got the second shot. I became eligible for the booster, got that, and I don't know how to get through to people facts don't matter. Science doesn't matter. How do you get through to these people?
Actually, I do want to counter that. I think labels are a distraction, and I take care of everybody. The quote I love is, "Our minds create the chasm, and our hearts cross it." And I have all sorts of patients that make bad decisions. They've been making bad decisions as long as I've been trying to help them, and I do what I can.
I wasn't trying to say that it was Republicans that don't get vaccinated. What I was saying is it's very hard to change beliefs. One of the things that's very distressing, there are about 11 people who have been all over the internet with anti-vaccine propaganda. Robert F. Kennedy Jr. is one. He was finally taken down from YouTube after months and months of lies about the vaccine gets in your DNA, the government is spying on you, and people believe it, and changing beliefs is very difficult. It requires a great deal of trust. Most of my patients that haven't been vaccinated are patients that are pretty new to me. I have pretty much no chance of changing their mind. I have a few that I've seen for a number of years where there's a trusting relationship, then I have some chance.
So as chaplains, we spend a lot of time trying to figure out how to love people that we disagree with, because love does change things. And it is not an easy task to go visit someone who is spouting off the stuff that we vehemently disagree with. But I know that human connection makes a difference. And I have a colleague whose sister refuses to be vaccinated, and she has begun taking the line, I really, really care about you a lot. I love you so much. I don't want to lose you. And perhaps if we could love that well, it's one thing to say that to a sister that you really do love. It's another thing to be able to say that to friends who you did like, at least at one point, and maybe don't anymore. But I think this idea that somehow love conquers things, I think it's the only way. I really believe it's the only way.
Well, maybe I can talk over that. Hello? Yeah. I'm thinking that like smoking, for a major society change, I think it takes a financial impact. And I fully would expect that insurance companies would start doing a rate change for those that do refuse to get vaccinated. And I think that may move society, but it's a slow move, and that may be the counter that's needed as a hit in the pocketbook to do it, which it's like, why should it take that? I hope love can do it, but that may be what it takes.
Thank you. You know, this reminds me almost of watching MASH episodes because, you know, it's such a crisis situation and you don't know where your resources are and you're trying to pull everybody together. And it's almost like the nation should really treat it as how do we support our military, you know, like they do during wartime, and it's how do you support the healthcare workers during this time? Daphne, I know you're sitting next to me now. I do appreciate the group expanding who healthcare workers are because I work at Mayo, been there for many, many years. And I talk with appointment staff in the cancer center that have the difficulty of telling someone, I'm sorry, your insurance isn't accepted, or we feel we don't have anything, but people just, they want to come. And, you know, it's really tough because I work in research, but I've talked with patients that live in another part of the country. Their cancer, the surgery that they need is on hold. The place that they're having surgery doesn't have enough ventilators, and their treatments are getting postponed, and therefore their life expectancy may not be the best. So again, for the group, I really appreciate you expanding that definition of who a healthcare worker is, and hopefully the appointment staff in certain areas are going to get a lot more support because I know that they're struggling. Yeah.
Thank you. Thank you for all what you said about that love essentially can save us. But I was curious about the three people that talked. What do you do to renovate yourself, to be ready for another day, and to accept sometimes patients that they're not doing what you would like or what you think is the path for recovery, either a vaccination or something else?
I think in the beginning, it was a lot easier, you know, can you please keep your mask on while you're in here and such. And now we have so many arguments every day and you just get so sick of fighting. In the beginning, it was done with great love. You know, we just really care about you. Please wear your mask. We want to keep us safe. We want to keep you safe. And now it's, why do I have to still wear this thing? And it's an argument. And I've gotten to the point when compassion fatigue with that kind of stuff, where it's like, just put on your mask. Like, I don't even want to argue about it anymore. Like, you're a grown adult. It's a piece of cloth. I wear it every day for 8 hours with goggles. Like, I know it fogs your glasses. I know this. I know all of that. And I still have to do it every day. So I'd appreciate it if you would. So, but yeah, it's just, this compassion fatigue is real. Like, you can ask my family, I'm a very grace-giving, love-filled person. And for some of my patients, I just don't have it anymore. And it's exhausting. So especially their family members who come in and refuse to wear them. But I mean, Mayo Clinic's given us permission now, saying if you refuse this, we will terminate our care with you and you can go to a different healthcare facility. Because we work with the most immunocompromised patients. They're going through active chemotherapy and people are up on our floor refusing to be compliant. So, and we received emails this week, if you are non-vaccinated, that you'll be terminated by the end of January. So like you said, unfortunately, it's going to probably take these mandates now, and money's going to have to come into play for people to just finally be like, okay, I'll get the shot.
I just wanted to highlight something that the chaplains have been doing during this time. Chaplains normally take care of patients, just like doctors and nurses do. But during this time, the chaplaincy department, the spiritual care department at Mayo, has upped the ante and has been doing things like Schwartz rounds, which are really meant to help the resilience of the staff. I think even my students spend more time doing staff care some days than they do patient care, because if the staff are in good shape, the patients can get good care. But it's really been remarkable to see how much people have glommed onto what we offer, partly because they just need some relief and somehow to find a way to put themselves back together every day.
Just, I think your question was what do we do ourselves to alleviate stress? Talk to our spouses and talk to each other. When I'm at work, we're always trying to encourage each other to vent. And it seems that intensive care doctors are very, just by the work that we do, we're kind of fiery and we want this now. And so we do kind of vent probably more easily. But also there's still the stigma of mental illness in healthcare providers that's not supported. You all probably don't know, when we go to fill out our licenses every year, there's a question of something along the lines asking about our mental health. Have you sought, or been diagnosed with mental health or something like that? That's on our license. Nobody wants to say yes, because we don't know what's going to happen if we do. And the physician or healthcare provider support offices, if someone is diagnosed with a mental health problem, they follow that person and often put restrictions on what they can do, or not restrictions, but put reporting requirements. You have to check in with so-and-so, and you have to take this course, and you have to prove that you've taken this course. And first of all, none of us have time to do that anymore. And nobody wants to have that amount of scrutiny over our lives. So mental health is very important in healthcare providers, and we're just as at risk as anybody else. I think women physician suicides is much higher than women in the general population, and physician suicides is double, I believe, what the general population is. And I have no idea what nurses are. I don't know why they haven't studied nurses. I can't find any data on that, but I'm sure they have a high rate too. So I don't really know. I mean, we vent to each other, and there are all these wellness programs and resilience programs, but we either don't have time to go to them, or they carry a risk that we don't want to take.
Okay, we're drawing to a close. And I just wanted to remind everybody that you do not need professional training to do what Mother Teresa calls small acts of great love. Now, to underscore that point, Karen Heaston is going to,
Before Karen ends the program, I would just like all of us to thank all of these care providers and for their stories today. It takes a lot of courage to share your story, to be vulnerable, to do that. And I just appreciate it so much. So if we could thank these people.
Okay, if the team can kind of stand shoulder to shoulder back here behind Karen, and then she'll do a solo a cappella version of Here I Am, Lord.
I, the Lord of sea and sky, I have heard my people cry, all who dwell in dark and sin, my hand will save. I who made the stars of night, I will make their darkness bright. Who will bear my light to them? Whom shall I send? Is it I, Lord? Here am I, Lord. Is it I, Lord? I have heard you calling in the night. I will go, Lord, if you lead me. I will hold your people in my heart.
If anybody wants to come forward to ask questions, submit a name to receive a letter, join the team, we'll stick around for a little while.